I prefer to just sit down with the patient and kind of find where their comfort is, and then suggest where we can go.
In this Backstage Pass series, we have authentic conversations about the evolving role that aesthetic procedures play in your life. We also dive into the often overlooked steps that you should understand before making the leap to your renewed self. These are the conversations that you want to hear, but just don't have access to until now.
Her main concern was the proposals were different at the multiple places that she visited. So why is that? Why can they be different?
So it could have been that the office didn't have the technology that we have. So for instance, we can do core liposuction here with Renuvion and skin tightening and avoid a tummy tuck if the patient's a candidate. So she could have received a proposal for that. It could have also been that, for instance, some surgeons will do only one area of liposuction with a tummy tuck, so they may have offered her to just do flanks. So it could have been that, or perhaps it didn't include surgeon fees, OR fees, garments, pre-surgical labs. Some offices break those out and you're responsible for those fees on the front end or on the back end. We own our own OR, so we don't do that. So everything is included. Okay. Garments, pre-surgical labs, surgeon fees, you won't be balance billed for anything. And that's different for other facilities. So it's just a good question to ask, are garments included, or are post-op visits included? And again, it could be, we own our own OR here. So offices that don't have facility fees, and they may make, payments to anesthesiologists or CRNAs separate from that. So everything is included in our proposals.
I know another concern of hers was financially, how is she going to do all of this? Because it's a lot.
Oh, absolutely. So
what are her options in that regard?
I mean, the majority of patients have some type of financing. So whether that be through Care Credit, which has some really appealing options that we offer. So we can do up to a year on no interest plans, and then we do all of their extended payment plans. I prefer to just sit down with the patient and kind of find where their comfort is, and then suggest where we can go. Because some of them will even go to a bank. Like when we do, if it's massive weight loss patients, those can be very expensive, and it makes more sense to go to a bank to finance that. And then we're going to offer a cash discount, and then that keeps them at a monthly payment because they know moving forward they're going to need multiple surgeries. So the best way to do that is just to come in and kind of talk to me and tell me what financially you're comfortable with, and then I can help make suggestions for how to move forward.